America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, and welcome to another episode of Main Street Matters, America's small business megaphone. I'm Elaine Parker, the president of the Job Creators Network Foundation.
And I'm Alfredo Ortiz, CEO of Job Creators Network.
Please subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from. Well, today, Alfredo, we are joined by somebody you know, actually, and that is Congressman, because he's your congressman, Congressman Rich McCormick, who is heads up Georgia's 6th District. As a decorated Marine helicopter pilot and now an emergency room doctor who served at the front lines against COVID-19, Dr. Rich McCormick has never been afraid of a fight. Whether it's communist China abroad or the radical left in America, Rich knows the next fight facing America is to stop socialism.
All right.
So before we get into healthcare with the congressman, and we should talk to him about how he feels about the ousting of Speaker McCarthy. It's really disappointing that, we had Speaker McCarthy ousted over 8 Republican congressmen, which was about 4% of that right. Caucus. And it was also disappointing that the Democrats lined up and they all sided together. That was something that I thought was really moving in Speaker McCarthy's speech when he told us that Nancy Pelosi said she'd never do that.
Well, yes, we're in a different era. That's for sure. But can you really blame the Democrats, though, for doing what they did? Because we're the ones that actually, I think, created this own issue with Matt Gaetz kind of leading the charge of it. Because, look, the Democrats have... they had the same kind of slim majority in the first couple of years, and they pulled off quite a few things. Now, I'm sure if you talk to some of our congressmen, and probably even Rich today, he would say that we got a lot of stuff done as well, and we did. But look, we as a party, it's very difficult, I think, for the Republicans to actually stick together. And I don't know why that is. The left always seems to be just working in tandem or working as one, I should say. And they just get things done that way. And we have to learn how to get things done by working together as well, because this country can't afford for it to be in the direction that it's going right now. We just cannot let this kind of stuff be distractions. What are we not talking now about? We're not talking about Biden inflation. We're not talking about the war in Ukraine. We're not talking about high energy prices.
Student loan bailout that's happening anyway.
$9 billion, right?
Yeah, you're right. The American people deserve better. They don't deserve civil war between the two parties. They certainly don't deserve civil war within the Republican Party, and we'll never see civil war within the Democratic Party. Yeah. You're right about that. They march in step. Hakeem Jeffries can just basically wave a wand and command everybody to do one thing and vote one way, and they do. And so what is admirable about being a conservative, the independent streak, the entrepreneurial, is, I think, probably what makes it so difficult to govern the party as well.
Right. No, it really is. But when you look at, again, what needs to happen and what needs to be done in this country, and what Democrats are what Republicans are getting ready for and gearing up for next year in 2024, which is a presidential election and elections in Senate and the House, and quite frankly, our governorships, right? This kind of stuff impacts the party.
Right.
There is a negative halo effect that impacts the entire R brand. When you heard a lot of folks on, Fox and stuff like that talking about this, there was a pretty clear consensus. There were only 8 congressmen, again, that actually voted with the Democrats to oust the speaker. And I heard one of the interviews that Brian Kilmeade did of the Republican from Tennessee, the congressman. And all he kept saying was, well, we're $33 trillion in debt. So, it was time for McCarthy to go. And look, I was sitting there thinking, McCarthy didn't put us $33 trillion in debt. Both sides actually got us to this point. Do we have to do something about it? Yes. But McCarthy shouldn't have been blamed for the $33 trillion in debt. He, I think, was making his way through the appropriations bills. It was difficult because the way we actually set him up in January, I almost set him up for failure, quite frankly. The rules that got him the speakership.
Right.
But, I think they had 4 out of the 12 bills already, basically passed and moving on to the other 8. So, they still had about 30 plus days of work to do to finish those. And I just think it was, quite frankly, not right to do what they did. And quite honestly, who would ever want to have that role? I guess 2 folks now, Jordan and Scalise. But boy, I sure wouldn't want to have that role.
Yeah, I think that you make a great point there about the R brand. It's bigger. This is bigger than Kevin McCarthy. This is bigger than Matt Gaetz and the 7 other congressmen who voted him out and ousted him. It is the R brand, and it is, what do they stand for? What are they for? And now no one's talking about what their party is for and what they want to do to make this country better for all Americans, to make the border safe. I know these aren't our issues for Job Creators Network, but these are issues as an American that I can't not see what's happening at the border, and healthcare. And I know we're going to talk to Rich McCormick, Representative McCormick, in just a few minutes about healthcare. We're going to ask him, what is the Republicans' plan? Because every single election, healthcare comes up and Republicans just don't seem to have a plan for healthcare. And I'm glad that he's a practicing physician, because he does have a great bird's eye view of what needs to be done in the exam room and what needs to be done in the Congress.
Yeah. And overall, though, that does seem to be what always is the image, I think, now of the Republicans, is that we'd never have a plan, right? McCarthy was ousted without a plan to, who was going to actually take his place. Healthcare, we wanted to repeal it, but what were we going to replace it with? There was no real plan, right? We as Republicans, as a party, as a conservative movement, need to learn how to actually sell a vision, or create the vision, quite frankly, and then sell it to the American public so they understand. I think the last person that truly did this from the conservative movement side was President Trump. Before that was Reagan. It was very clear in terms of what they both wanted to do, right? If you look at President Trump, even though the Democrats are using the mega mooga maga, phrase, but make America great again. Mm-hmm. Very simple, right? It was a clear vision. We know Obama did a good job of it from his side.
He did.
And so we just need to learn how to be able to articulate a vision.
Absolutely. I wish they would listen to you more.
I do too.
All right. Well, now it's
maybe
time.
I should run for president.
I think you should.
Maybe I should. Maybe I'll announce it right here.
Now it's time for our interview with Congressman Rich McCormick, who is Georgia's who is the congressman for Georgia's 6th district. With over 20 years in the U.S. Marine Corps and Navy, Rich served in combat zones in Africa, the Persian Gulf, and Afghanistan. As a Marine, he flew helicopters and taught at Georgia Tech and Morehouse College as a Marine officer instructor. In the Navy, Rich earned the rank of commander and served as the department head for the Emergency Medicine Department in Kandahar, Afghanistan. Rich is a graduate of Morehouse School of Medicine, where he was also student body president, and completed residency in emergency medicine through Emory while training at Grady Hospital in Atlanta. He also received his MBA from National University in California. Congressman McCormick, welcome to Main Street Matters, America's small business megaphone.
My pleasure. Good to be with you.
Great to be with you, Congressman. And again, thank you. 6th District is my hometown, so appreciate you making this happen for us. And you are doing wonders in our 6th District, so thank you very much.
Well, thanks. Team effort. I've got great staff. Constituent services as our focus. We know that DC is going to be a bit messy at times, but we can always care about every phone call we get that people need help for.
Absolutely, absolutely. And before we actually get into the interview, we wanted to talk a little bit about the chaos we've been seeing this week that happened in the House. Obviously, the speaker's was vacated by McCarthy, and I guess the House is now looking for a new speaker. Hopefully, that will happen sometime soon. What are you hearing from your end?
Well, I've been talking to people who are running for that position. I just got off the phone with Jim Jordan, before that Kevin Hearn, and then other people who are lobbying for individuals. I'm sure Scalise will be calling me here shortly. I'm leaving for Copenhagen tonight to actually vote in the parliamentary NATO Parliamentary Assembly for a new leader of that, because the person who was the head just lost their election. So these are tumultuous times across the world right now. We have a lot to really consider. A lot of Ukraine has become a divisive issue, obviously. We're trying to get a budget process done that we haven't done in decades. And that's with a small majority and with people disagreeing. So this is going to be, I mean, anybody who wants to predict what's going to happen doesn't realize that no one alive was alive when this happened last time. And last time it happened, the person didn't get kicked out. So this is literally, I'm as experienced as anybody in Congress when it comes to something that's never been done before. It's going to get ugly.
Yeah, absolutely. Well, hopefully we can get our house in order truthfully. I listened to the 1 hour speech that Hakeem Jeffries gave from the Democrat side on Sunday. And the one thing that I think stuck out and was kind of biting and kind of hurt the most was when he said that they had the exact same slim majority when they controlled the House, and they got a lot of stuff done. And so, hopefully we'll get to the point where we have that same slim majority yet again, but we get a lot of stuff done.
So in our defense, I do want to speak to that point, because there's a misconception. When you talk about getting something done, an omnibus is easy. You just force something through that, it has everybody's stuff in there, massive spending hikes, massive debt. That's getting something done, all right. But nobody really had direct input. What we're doing, we're getting way more than they did when it comes to real work. When you talk about the budgetary process, when you talk about appropriations, where people actually do amendments, where we do the constitutional responsibility of actually going line by line, making sure that your money is spent the right way. We've done way more work than they ever did when they were in charge, because when they're in charge, they allowed no one to speak out. They allowed no one to step out of line. And quite frankly, we're doing it the constitutional way, where you actually have direct representation. Each congressperson has the ability to amend each bill and then get it appropriated and get it over to the Senate, whereas that never happened last time. We haven't done a budget the correct way in well over a decade.
Yeah, it is crazy. I like calling the the omnibus bills ominous bills, actually, because that's kind of what they are. Because the specter of deficits is just so great. But to your point, I guess for our listeners and viewers, there are 12 appropriation bills, I guess, that need to get passed by Congress. I believe you guys had actually achieved 4 of those bills, if I'm correct. Am I getting my facts right?
Yeah, all the way to the end process. We have 70% of the budget's already funded.
That's great.
So we're still debating the remaining 30%, and most of that's done too. It's just getting held up in rules. And also, just through the appropriations process, takes a lot of haggling, because to get 218 votes in Congress is not always easy, because we disagree on some things, some very major issues. But we're almost there. We just need to keep on doing this. We need about a little bit more than a month, if I was being honest. But now that's going to be delayed even more because of what we just did with the speakership, which is a self-inflicted wound, in my opinion. It's not going to solve the real problem. Matter of fact, it may set us back as much as 3 weeks.
Understood. Well, we wish you the best up there, because obviously we need to get this done right, and we need to get our fiscal house in order. So, keep on pushing, as you always do.
Thank you.
Elaine?
Well, Congressman, I'm going to switch gears on you just a little bit. In addition to all the drama that you're seeing as a congressman and the good work you do every day up there, you're also a practicing doctor. And I wanted to talk to you a little bit about what some of the biggest problems that your patients face from our healthcare system today.
Well, there's a huge imbalance in payers, and this is what just put Atlanta Medical Center out of business. We lost one of our trauma one centers in downtown Atlanta. Now Grady's overwhelmed. That spills out into the suburbs. That payer mix is now absorbed by everybody else. The reason that hospital went under is losing hundreds of millions of dollars per year is because we rob Peter to pay Paul all the time. And this is why there's bad behavior. We've encouraged this monopolistic hospital system to pilfer funds that they get paid first before the average doctor does, even though the average doctor probably can get the same kind of job done with 25 to 33% savings. We've allowed doctors to become more and more hospital employed. We're over 70% now. We have a consolidation in healthcare because we cannot afford the administrative costs. If you look at the hospital systems and the EMR systems for alone, there's 2 hospital systems in Atlanta that just spent $700 million each on Epic. And they still don't communicate with the other systems. I worked on Cerner and Epic and T-Systems. I've worked on, I don't know, half a dozen different systems. They all have their problems, but they're extremely expensive. This is an arms war on how we get reimbursed. There's up to 40% of non-reimbursements from insurance companies. Medicaid and Medicare have different kind of systems, but basically when we're not empowering our people to actually get reimbursed by insurance companies, they're making record profits every quarter. PBMs are misbehaving. It just drives the cost up for medicine for those people who are actually paying for this, which is the insured people and the taxpayers. It is now the single biggest spending item in government, the fastest growing expense to all taxpayers. And it's at 26% of the entire budget is taken up Medicaid, Medicare. We spend about $500 billion in waste on healthcare, both on private and government spending every year on just the wasteful administration practices, arguing over who gets what dollar. And once again, meanwhile, the people who are least likely to lay hands on a patient benefit the most. They're the most profitable, and the people who never see a patient, but the doctors and the patients are the ones suffering the most. Doctors took a pay cut of over 2.5% last year, whereas patients took a huge pay hike or expense hike again. So the taxpayers, all the money's going to all the wrong places, and I'm really sick of it.
But Congressman, I thought the Obamacare was supposed to take care of all this. What's gone wrong?
It's actually it's encouraged the consolidation of healthcare. Administrative costs continue to climb. Since Obamacare was instituted, we've gone from the average administrative fee of 25% up to sometimes 30 to 40%. We're still fighting over the same dollars. The expense has gotten worse. People have been empowered to fight us and not pay us. The process where we said you have only so many days to get back to the people, well, then they just deny them. And then that just draws it out more. And then they have to go to arbitration. We did a surprise billing act that would get past that, so we couldn't have people just deny us. And that just backfired too, because the Secretary of Health and Human Services, who is a lawyer, not a doctor, literally has benefited all the insurance companies, says, no, we're not going to allow you to win against, in other words, if you're a healthcare provider or a hospital system trying to get reimbursed. He stacked all the cards in the favor of the insurance companies. When we took him to court 4 times now, he's lost all 4 of those and keeps on doubling down. I think he's an evil guy. I think his position should be defunded. He should be fired. He is in the way of good healthcare. He's in the way of patients being served better and doctors getting paid. It makes no sense.
Yeah, absolutely.
Congressman, I mean, you clearly have probably one of the best views of what the problems are from a policy perspective, but also from a physician perspective. What is the Republican healthcare plan?
Well, there's the problem right now. We have a extreme shortage of people who understand healthcare. Even the doctors caucus, man, we have probably about 14 doctors in Congress. Of them, probably about half of those actually participate regularly in the doctors caucus. I think only a couple of them are Democrats. When we sit down, we disagree on things, but we have 128 bills out there. That's just in the doctors caucus alone. Of those, I thought 3 of them have any germaneness, any teeth that can actually get something done. In all of Congress, there's more bills than there are congressmen. There's over 460 bills on healthcare. That's just simply not going to solve anything. Most of them are just reporting processes and things that just set up the next step. We had a healthcare system that was improved on Obamacare. Of course, John McCain famously voted that down. I think we should start with something that's kind of, instead of recreating the will, come up with something that we almost voted last time and take out the stuff that were detrimental to it passing and reinstitute it. Because quite frankly, what we have right now is horrible and it's only getting worse. The problem is we have a split House and Senate, and we have a president who's not favorable to changing anything because they want to claim that Obamacare is working, even though we know it's failing dramatically. It's kind of like his border policy. I mean, he wants to pretend like there's nothing wrong. Meanwhile, we're getting flooded, and even Democrats are tired of it. As a matter of fact, if you really want to look at the things that unite us, divide the Democrat Party, it's the border, it's crime, it's healthcare. Well, at least the dissatisfaction unites us. It's debt, and it's education. If we focused on those things, we'd win overwhelmingly.
Congressman, it seems like every 2 years almost, whether it's a presidential or midterms, the issue of healthcare comes up, and we always seem as Republicans to be deer in headlights though on this thing. I mean, where is the leadership of to create that vision for healthcare for America that people are going to understand? Because Obamacare may have been a disaster, but when Obama actually introduced it, at least he introduced it as a vision. Granted, it was a bad vision, but it was a vision that America bought. And so, how are we gonna do this? How are we gonna show the American public what our vision is?
So I'm going to tell you something that's hard for me to admit. Until America gets really fed up with this, it will not be our focus. Congress is far too often reactionary instead of being proactive. That means that when people get upset enough about it, all of a sudden it's our first and most important issue. This is what happens with the border or education or anything else. Until people get fed up with it, it won't be addressed. And then it'll be a knee-jerk reaction. We're scrambling to come up with something that's acceptable to the people. The problem is healthcare is probably the most complex, and it definitely is the most expensive thing we got going in government. If you think about the major lobbyists and the people involved in the healthcare industry, most doctors have no concept of the holistic approach to healthcare, not medicine, but healthcare costs. When you consider the amazing power that a lobbyist has is in the insurance industry or the PBMs. And then you also have the GPOs, the hospital systems, the healthcare industry, such as, in other words, the providers, which is diverse also. You got doctors, you got mid-levels, you got nurses, you got techs. Now think about all that in a $6 trillion budget just for healthcare. And even if you want to cut that in half, the amount we spend on healthcare just in the government is the same size as the GDP of India. Think about it. Let that sink in. A country of 1.47 billion people has a GDP the size of what we spend on healthcare just in government. If you add on our private funding of healthcare, it's probably closer to the third largest GDP, which is more similar to either Germany or Japan. So we have serious problems. That's why we're going to look at the administrative costs first, because the problem is when I go in front of Congress and I say, look, we need to decrease spending by 15% on healthcare, just on administrative costs would do that. Because that's where all the waste is. And as soon as I say that, Democrats are going to say, oh, Rich McCormick wants to get rid of spending for healthcare for old people and poor people. You see where we end up? And now we can't have a real conversation about saving our healthcare.
Right. Well, I'll tell you that I think our small business owners are going to be the first ones that are going to start crying foul on this, because I think we just saw a report that said that the premiums for small business owners are going to be doubling possibly by next year because of the healthcare costs are out of control. And look, I mean, there are past efforts like the Association Health Plan that Secretary Alex Acosta tried to introduce when he was Labor Secretary. That got pounced on immediately in the courts by the Democrats. But our small business owners are really the ones that are really getting hurt in all of this.
And it's the second leading cost to all businesses on average. And on top of that, you have pricing for employees going up anyways. I just don't see how we continue to have good, strong, small businesses in America if we continue this plight. And eventually people are going to say, well, screw it, then let's just go to a single payer system. That's the conversation that people are having right now. And that's dangerous because it's not going to get less expensive. It just means more taxation on corporations from the government, which you can't fight either. So it doesn't solve the problem. We have to make healthcare more lean, more efficient, more accountable. If we go to a single payer system, it's going to do none of those things. People are going to be still just as upset. It's going to be just as expensive, and we're not going to get anywhere. We have to address it's just like with education. You can talk about free education for everybody. It's not going to be free. It just means the government's going to pay for it out of your taxes, which is going to be another corporate tax, another individual tax, and it's not going to make accountable the education system. We need to make the education system, the medical or the healthcare system accountable to us, the people, and you don't do that by having the government get involved. The government has never, mark my words, never been efficient, never been accountable. And if we get, and you notice the more the government gets involved in healthcare, the worse and more expensive it gets. That's a fact.
Yeah, the two biggest areas where government's most involved in, right, have the most intervention, healthcare and education, are the ones that are the worst off in our country. So, yeah, we definitely need less government there.
Well, I know that the Democrats readily admit that Obamacare has failed, and here's how they do it: because they keep increasing the subsidies that people get to be able to afford Obamacare. And so to me, that's a clear admission that it has failed. But I think we have to kind of take a step back and go to the American people and educate them about the healthcare system and what a good healthcare system could look like. And that's one where doctors and patients get back to making the decision together. We get bureaucrats out of the exam room, and we create a healthcare economy where there's choice and competition and price transparency, because there's no sector that where you don't have choice and competition and price transparency, that prices don't come down. I mean, think about when the eye surgery, what's it called? LASIK first came out. When it first came out, it was very, very expensive. Only very wealthy people could afford it. Now it's a very affordable procedure, and the technology's only gotten better. But it's because it actually wasn't covered by insurance, and as far as I know, still isn't. And doctors had to compete on service, price, technology, and the prices came down and the procedure got better.
That is a prime example. I use that example myself all the time. When you have competition, that surgery 30 years later is 1/4 of the price. That would not be done if you had a set piece. If we were to start and say, well, the government's going to afford it, so we're going to make that automatic. It'd be, instead of being $4,000, it'd be $10,000 per eye now. It would be twice as expensive 30 years later, at least.
Yes.
And instead, we let fair competition drive the price down, and it resulted in something very, very good. Plus, like I said, every time and this is why cash pay, this is why we need transparency, because we really do. If we don't spend all the money on the administrative costs, we can really make this a lot more affordable.
And I actually have, because I've worked so much on our healthcare policy with Job Creators Network, I actually decided to try, I talk the talk, so I decided to walk the walk. And I have a direct primary care physician. I pay a monthly fee. It's like a gym membership, but I can get a hold of her anytime I need her. I can message my doctor. She messages right back. I can get appointments with her. She takes the time and spends with me, and it's one price. And I never stop talking about how valuable that is for me, and how much, and I've educated a lot of my friends, but that's where I think we have to start, is educating people on, when you start to take the complexity out of a system, you are removing costs and making it more affordable. Right now, the system that's in place, there's no incentive for the patient, the insured, to look for better pricing, because they care about two things: their premium costs and their deductible. That's all they care about. And if they can afford those two things, they don't care what anything else costs. So we have to bring them into the fold and help them understand how they can contribute to bringing down the cost for not only themselves, but the entire system.
You brought up a really good point, but quite frankly, the government doesn't want people thinking like you, because when you do what you're doing, it's the most efficient way to deliver medicine. It doesn't pay for everybody else. The government, quite frankly, designed this so that insured people would pay for uninsured people, even for Medicaid and Medicare, which is technically insured, but even for those people who don't even pay, period. I mean, think about the millions and millions. We just absorbed 7 million people this year from outside of our country illegally. You're paying for those people too, whenever you pay your premiums. You're paying for Medicaid and Medicare, because that's essentially, it's basically pro bono. we're not paying for the bills with the government, so it has to be made up in the private insurance. What you're doing circumvents all of that. It's the most efficient way to do it. The government doesn't want that. They want you to pay huge premiums so you can pay for everybody else's healthcare that can't be paid for by the government. That's why these payer mixes matter so much, and that's why several hospitals are going out of business, because they can't afford a payer mix where you're getting paid by the government, because once again, they're going to be fighting over the bills, and they're not going to get paid, and they're not going to get paid fairly.
Yeah. Well, Congressman, I know we are running short on time here. I wish we could have all day to talk to you, but I know we don't. I know you got some important things to do. So, but before you leave us, how can people find out more about your initiatives that you and your staff are working on?
So I got two, one on the campaign side, richmccormick.us, and also mccormick.house.gov on the official side. You're welcome to reach out to my constituent services. Anytime, if you need anything, we're there for you. It doesn't matter if you're a Democrat or Republican. That's not what matters to me. What matters to me is an efficient government that serves you. We're not here to lord over you. The people are the real power. That's what our Constitution made this nation so amazing, is that we're the one government designed to empower people over a government. And as long as we do that, we'll be all right. As soon as we make the government in a position where they can make decisions for everybody else, I don't care if it's on vaccinations or healthcare or your business or anything else, we fail. That's been tried and seen as failure across the world. We're not going to do it differently here. We got to keep it the way we've always had it, empower the people.
Well, Congressman, thank you so much for taking the time to join us on Main Street Matters, America's small business megaphone. And thank you all for tuning in. You can subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from.